Hi everyone, this is Dr. Stefan. So, maybe you've been diagnosed with COPD, chronic obstructive pulmonary disease. What does this mean in your case? What can you expect? This is what I want to cover in this video. And first of all, I'd like to start by saying that COPD, chronic obstructive pulmonary disease, is a very common diagnosis. It's something that many people will struggle with. And in a sense, that's a very bad thing. But at the same time, it means that there's lots of support out there and lots of doctors who will recognize this condition early and give you the right treatment, no matter where you are in the world. There are very good guidelines that guide the treatment for COPD. So most physicians all over the world will be able to treat this condition fairly well. So this is the first thing. The second thing I would like to say is that it's really, really important to try to read and understand as much as you can about the condition, especially as it relates to your case, because there are different types of COPD, which can be, milder forms, more severe forms. So it's really important to try to understand where you stand. And then you may also be a patient who doesn't really mind that much whether you have a diagnostic label, although sometimes people, when they look up information online, are a little bit worried. So if that's your case, that's absolutely fine. That's understandable. For some patients, having COPD is no big deal. For some people, it can be life-changing because it may mean that they need to change a lot of things about their lifestyle. They may need to take medication or treatments that they weren't used to taking before. So it can be a big and important step psychologically. You need to cope with it, and that can be tricky. So in this video, I'd like to cover some things. I have a couple of notes about what your life may be like if you are suffering with COPD. Now, first of all, I'd like to just say that I'm not your doctor, so please check all the information that I'm presenting here as it applies in your case by talking to your own healthcare team. That's really important, and I advise you to do that with any information you find online. Wherever you read it, try to check whether it applies in your case by discussing with your own physicians. Now, the first thing I would like to start off with is by saying that if you do suffer with COPD, you need to understand that this is a condition which is manageable. So in most cases, it can actually be stopped or slowed down. So the worsening of the condition can be managed, especially if you implement some of the other points that I'm going to touch upon next. The second thing is that treatments are very, very simple. So in most cases, it can be treated actually by just using inhalers. So things like this one. As long as you're using good inhaler technique, if you're on the right inhalers, it can control and improve your symptoms a lot. So if you are struggling with inhaler technique, there are plenty of videos out there. I also have a bunch of them on my channel, but also the best thing you can do is to take one of these inhalers, take your own inhaler to your next consultation with your doctor or healthcare team and show them how you are using it so you can get some direct feedback on whether you are doing it correctly. The other point that I'd like to make is that there are various severities of COPD. Just as I was saying at the beginning of the video, some people may have milder forms of COPD, while other people may have more severe, more advanced forms of COPD. Of course, the best situation is when we discover this condition early. So some of the early diagnostic features are if you're having breathlessness and cough. So if you're struggling with these things and you go and maybe your doctor suggests that you have a breathing test, a spirometry, you fit the criteria, the symptoms, you may be diagnosed with COPD earlier. If you're diagnosed earlier, you can implement some lifestyle changes that will control the progression of the disease, and hopefully it doesn't get much worse in your case. And that can be, in most cases, managed. The fourth point, and which is really, really important, is that lifestyle changes do have a big, big effect in this condition. This is what I want to really emphasize in this video. The first thing that you can do if you've been diagnosed with COPD is to stop smoking. If you are still smoking, you are actually worsening the condition. In most cases, COPD is actually due to cigarette smoking. Vaping is probably not a good idea. It's probably better than regular cigarettes, but I would suggest that you stop smoking completely. At the same time, COPD can be associated with certain environmental exposure. So if you're inhaling lots of dust, you may consider changing the environment where you work in, ventilating the place much better, using protective masks, etc. So try to think about those things. It's important to protect your lungs, especially if you've been diagnosed with a chronic respiratory disease like COPD, to try to protect your lungs from worsening. The other thing that you can do is to get moving as much as possible. Physical activity is going to help strengthen the respiratory muscles, help you cope better with this condition. So COPD can have moments when it can flare up. So that's when your lungs are actually much worse than usual. In those situations, if you are moving and if you are strong enough, you'll be able to cope better with a chest infection, with other situations which require your muscles to engage more. So keeping active is really, really important in this condition, because as you are more breathless, you are going to have the tendency to do less and less, which is going to lead to a vicious circle in which your muscles atrophy, you get weaker and weaker, you do less and less, and of course, it's a rapid decline from there. So try to keep moving as much as possible. There are actually pulmonary rehabilitation programs, so formal programs where you can work with physiotherapists in order to actually learn how to do the right exercises for your lungs. So do ask your doctor if there's something like this available in your area. The next thing that you can do is try to eat well as you can. So diet plays an important role. Try to maintain a normal weight. So of course, not eating junk food and all these things is very important. You probably can talk to a dietitian about this if you need to, but try not to eat too much or too little in order to maintain a normal weight, because again, that plays into how your body copes with this condition, and especially when it flares up, because that's when your body is under more stress than usual. It's important to treat any other conditions which may be associated with COPD. COPD, unfortunately, sometimes does not come on its own. There may be other conditions. There may be heart disease, there may be diabetes. It's important to keep these under control, because if your body is struggling with several conditions at once, of course, it will struggle to keep up. So you will need a lot of treatments. Treatments in themselves can have interactions between each other. So a lot of things can be actually managed with minimal medication as long as you treat it early. So I do urge you to try to talk to your doctor and see what else you may be suffering with and treat those conditions as well. Treat the comorbidities. The other thing I'd like to mention is that sometimes people who have especially more severe forms of COPD may need to have extra oxygen. So this may mean that you may need to use a cannula that goes into the nose to give you an extra boost of oxygen, because your lungs cannot supply enough for your body to have enough circulating oxygen in the blood. So in those situations, of course, going on oxygen as you need it, for example, when you're walking around, when you're doing something strenuous, can be helpful. It is a form of treatment. It's not necessarily to treat breathlessness. It's just to correct the oxygen levels in the blood and to prevent putting more strain on your heart and create unstable situations for other organs of the body that lead to further conditions which may be diagnosed in the future. So trying to prevent other conditions by using oxygen is really important, but I do understand that psychologically going on oxygen can be really tricky. So if you are struggling with this, try to see oxygen therapy as that therapy, treatment, a way in order to prolong survival, to improve your overall health. And if you do need oxygen, you have to use it as indicated, because it is a form of treatment. If it's prescribed to be used at 4 liters a minute, 3 liters a minute, try to respect that flow rate, because that's the one that corrects the oxygen levels in your blood as you need them. Obviously, if you're struggling with breathlessness, with your symptoms, with oxygen therapy, with all these other things, it's important to seek psychological support. And this is something you shouldn't be afraid of. You shouldn't be ashamed to do that. There's lots of people, unfortunately, who do struggle with severe depression when they have COPD. And that can tie into a lot of other issues. If you're suffering with anxiety, depression, you need to take medication for that. That again can have interactions with other tablets that you may be on. It may lead to you not using your medication correctly, to making poor health decisions and choices. So it's really important to seek psychological support early. Try to find friends and family who may support you. Try to get involved in social activities. Try to keep yourself busy, and try to not see COPD as a condition that needs to limit your life in such a major way. Of course, there will be limitations if you are diagnosed with this condition, but try not to let this bring you down completely. Try to keep going as much as you can. And because it's such a common disease, it's really important to think about support groups. There may be places that you can go to in your local area. Try to ask your family doctor, your general practitioner, hospital, physicians or nurses, or other people in your community. Look it up online. There may be support groups in your area. Sometimes you can have, especially after the pandemic, support groups that meet online on Zoom meetings. Even these little things can help you understand your condition better, talk to like-minded individuals, people who may be struggling with the same things, and get the answers that you are looking for. Also, try to read up online as much as you can. Like I said at the beginning, this is a really important thing. There are always new treatments that come up. You may ask your doctor if some of the new treatments are right for you. You may try to ask them whether a new inhaler may be good in your case. If you're trying to use a different device that may improve your breathing, try to discuss these things with your doctor. Try to see which ones are the right ones for you. Try to do your own research. This is really, really important. And the final thing that I would like to say is that try to attend for regular checkups. If you're suffering with COPD, going for regular follow-up visits with your doctor is one of the best ways to stay on top of your condition, to identify any other problems that may come up as early as possible, and to just slow down the progression of the disease by being on optimal treatment. So that's really, really important. You can ask them about your support groups in the local area, pulmonary rehabilitation, exercise programs, diet. All these things are easier to approach when your doctor knows you, you've come for your checkup regularly, and it's a lot easier to build rapport and ask all the right questions and not feel ashamed to or embarrassed to just check in with your doctor every now and then. I hope this video was helpful for you. Like I said, if you've been diagnosed with COPD, please try not to worry too much. It's a frequent condition. You just have to implement the right lifestyle choices to prevent further decline. Take your treatments as prescribed. Discuss with your doctors if you're having any other problems. And if you have further questions, do leave them in the comment section below. I'll try to answer many of them as I can or make future videos. I wish you all the best and good health.